Good morning, everybody. Welcome to the Center for Addiction and Mental Health. Bienvenue au Centre de Toxicomanie et de Santé Mentale. My name is Sarah Downey. I'm the president and CEO of CAMH. To start today in a good way, in this momentous occasion, I'd like to call upon Walter Lindstone, who's an implementation specialist at Shkabe-Makwa, to provide us with an opening prayer.
Good morning, everybody. Kokmishkabe was the Dishna Kaspo Prashina Dodem, Bawatine Donjin Shnabe and Dal. I'd just like to open today with giving thanks for bringing us together for this wonderful announcement. Creator, any help that we get to help with mental health and to help with the crisis that we're dealing with here in not only Ontario, but across Turtle Island. We're always grateful for these beautiful things that you provide, for all these resources, all these people that have gathered today. I ask you to bless them, bless their loved ones and their families, bless all our patients, our clients, our community members. Creator, we're grateful for the four-leggeds, the crawlers, the swimmers, the flyers. We're grateful for Mother Earth, the winds, the waters, and all those beautiful things that you provide to us to be able to continue to help us to live a good life. What is it that you ask of us, Gitchamanado? What is it that you ask of us? Ajwa Minishna Gitchamanado. Ajwa Minishna Gitchamanado. Ajwa Minishna Gitchamanado. Ajwa Minishna. I just said in the language, send us your love. Thank you so much.
Thank you very much, Walter. These are very stressful and exciting occasions, and it's so wonderful to take a moment to be grounded. Before we begin, I would like to acknowledge that CAMH is situated on lands that have been occupied by First Nations for millennia, lands rich in civilization, knowledge of medicine, architecture, technology, and extensive trade routes throughout the Americas. In 1860, the site of CAMH appeared in the Colonial Records Office of the British Crown as the council grounds, the Mississaugas of the New Credit, as they were known at the time. Today, Toronto is covered by the Toronto Purchase Treaty No. 13 of 1805 with the Mississaugas of the Credit. Toronto is now home to a vast diversity of First Nations, Inuit, and Métis who enrich this city. CAMH is committed to reconciliation. We will honor the land through programs and places that reflect and respect its heritage. We will embrace the healing traditions of the ancestors and weave them into our caring practices. We will create new relationships and partnerships with First Nations, Inuit, and Métis, and share and protect the land for future generations. I'm very pleased to welcome back the Honorable Ya'ara Sachs, Minister of Mental Health and Addictions and Associate Minister of Health. Minister Sachs visited CAMH shortly after she was appointed to this portfolio, and it's a pleasure to have you back here today on such a momentous occasion. I also want to acknowledge that the many CAMH staff, partners, supporters, mental health advocates, and experts who are with us in the room and virtually managing a very complex command center today. Today marks a monumental milestone for our country. Starting this morning, people across Canada now have access to a new and important source of hope, 988, Suicide Crisis Helpline. This new service, launched alongside the federal government and a national network of partners, is powered through CAMH. Teams across our organization have worked tirelessly with tremendous efforts and vision and collaborative energy to bring this concept to reality. Many have been here all night long and are looking so fresh in the front row. Today's launch, which I will let the minister and others speak to in a couple of minutes, is the result of collaboration across geographies, industries, and cultures. It's an honor for our organization to have been entrusted to build this life-saving service that extends into every corner of our country. It's also a testament to CAMH's unique expertise in clinical care, technology, research, education, and policy development, which allows us to support a project of this scale. I can't even begin to name all of the people and teams at CAMH who helped us get here. Many of them are right in front of me. From project design to technology, partnership agreements, marketing and communications, and everything in between, CAMH staff continue to answer the call. Although a tremendous amount of work has gone into preparing for today, the opening of this service is just the beginning. You can count on CAMH to continue to lead 988 with a laser focus on partnerships, user experience, and evidence-informed best practices. Please know how tremendously proud and grateful I am to each of you for all that you've done. Maintenant, il me fait plaisir d'inviter l'honorable.
I now have the pleasure to invite the Honourable Elizabeth Bruyère, our Parliamentary Secretary, the Minister of Families, Children and Social Development, and Member of Parliament for Sherbrooke, to the podium.
Secretary to the Minister of Families, Children and Social Development, Member of Parliament for Sherbrooke, Madame Bruyère.
Good morning, everyone. Hello, I'm very pleased to be with you this morning for this huge announcement. My name is Elisabeth Brière. I'm the Member of Parliament for Sherbrooke, Quebec, and Parliamentary Secretary to the Minister of Families, Children and Social Development. I'm pleased to be with you today for this important announcement, which will provide enhanced Canada-wide coverage and improved access to suicide prevention support for those in need, no matter where or when they seek assistance. Je remercie et félicite l'équipe.
I'd like to thank and to congratulate the team and the whole Public Health Agency of Canada who have worked to develop the new 988 line, and Dr. Alison Crawford, as well as all those at CAMH who will lead the coordination of this service. Thank you.
I admire the extraordinary work for your organization does to promote positive mental health and improve access to supports and services for those affected by mental health problems. Maintenant, je suis fière d'accueillir ma collègue.
I'm now very pleased to welcome Minister Sachs.
I would like to invite Minister Sachs to the mic.
Good morning, everyone. Bonjour à toutes et à tous. I am so excited to be with all of you here today. But before we begin, I'd like to take a moment to acknowledge the land on which we gather. The treaty lands and territory of the Mississaugas of the Credit. And just to take a moment to acknowledge that for thousands of years, Indigenous peoples have inhabited this place, cared for this land and its people, and continue to do so today. These are sacred spaces of healing, of caring, of love and compassion, and I can think of no better embodiment of that in the space that CAMH holds on these lands. I want to thank Walter Lindstone for opening us in a good way, miigwech chi miigwech. It's such a pleasure to be with all of you here at the Center for Addiction and Mental Health. It's not my first visit here and it will not be my last, and it feels like coming home. Throughout this entire process, you've been our partners every step of the way, and I cannot thank Dr. Alison Crawford and the entire team of CAMH enough for everything that you have done to get us here today. From the bottom of my heart, I really want to thank you for the important work that you do. And I really also want to take a moment to thank my friend, my colleague, my mentor, Dr. Carolyn Bennett, for all the work she has done to create spaces and services of healing in this country, including the 988. She's been so critical in this file and in the work of bringing health and safety to Canadians over generations and decades. And Carolyn is a big part of why we are here And I could not be more thankful for her dedication, creativity, and most importantly, her compassion for everyone we are supporting across Canada. She's truly a friend to all of us. I'm also honored to mark this very important milestone alongside my colleague and friend, Parliamentary Secretary Elizabeth Briere. Mille fois félicitations et merci.
Congratulations and thank you.
On the 988 to get it off the ground with bi-weekly meetings with department officials and with the team here at CAMH. And I know how important this was for you and what a drive it was to get us to this launch. Thank you for everything. I also want to take a moment to acknowledge the crisis and distress centers from across the country who are part of the 988 network, from Vancouver Island all the way over to St. John's, Newfoundland, from Nunavut and everywhere across this country. You've been up since the wee hours to get us to this moment. But you've also been on the front lines of helping those in distress for many, many years. And it's your commitment and dedication that got us here today. I'm thankful to each and every one of you. And I know that Canadians will also be thankful for the support you provide, because right now, if we're truly honest, Canadians need our support more than ever before. Suicide is a leading cause of premature death in our country. Every year, approximately 4,500 people in Canada die by suicide. It's a hard number to sink in. 12 people die by suicide each and every day in this country, and that is 12 too many. There's 12 too many families with broken hearts, 12 too many communities who grieve each and every day. Each loss is tragic, and I know I've said this many times in recent weeks. I will say it again and again and again. Every person lost to suicide leaves behind a grief-stricken family, friends, and loved ones who struggle to pick up the pieces, and they're shattered with the loss. It's deeply personal to so many of us, not just in this room, but across the country, because we know that losing someone to suicide sticks with you throughout your life. And I want families, friends, and loved ones to know we see you, we're here for you, and we embrace you. Every person in Canada deserves access to crisis support services when and where they need it, and we are providing that lifeline. All of us in this room and many more across this country have been committed to this goal of ensuring that people across Canada have the best possible mental health and crisis intervention supports and resources when they need them. So today, I'm so proud to say that we are one step closer to getting to that goal. Here we go. As of this morning, Canada's new 3-digit number for suicide prevention is up and running. Thank you. (988) Suicide Crisis Helpline is now available across Canada in both English and French, 24 hours a day, 7 days a week. People in crisis can now access help by phone or by text, no matter where they live in this country. This line, at the end of the day, is really about meeting each and every one of the Canadians who are struggling across our country, where they are and when they need us. We all know in this room what it means to show up for someone, to be there in that critical moment when they need that voice on the end of the line. And we all know someone who has been struggling with their mental health. Many of us have been touched by suicide, losing family, friends, colleagues, and community members. Le 988, ligne d'aide en cas de crise suicidaire est
The 988 is now available across Canada in both English and in French, 24 hours a day and 7 days a week. People in crisis can now access help by phone or by text, no matter they live in the country. This line, at the end of the day, is really about each and every one of the Canadians who's struggling across our country, no matter where they live. We all know someone who's struggling with their mental health. Many of us have been touched by suicide, losing family, friends, colleagues, and community members.
We all know that 988 will help save lives. For someone who's at their lowest point, a caring voice on the other end of the phone is that lifeline. This Canada-wide suicide crisis helpline is being led by the Centre for Addictions and Mental Health, lovingly known as CAMH. CAMH has linked together a network of experienced crisis and distress centers, enhancing support across Canada and ensuring that help is never far away for people reaching out. Everyone who answers the call or text is trained in suicide prevention, with a focus on providing trauma-informed and culturally appropriate care. In a few moments, you will hear more about this from our many key partners. Responders, and all of you in this room, you are the experts. You know your communities. You know the unique needs of your regions, and that matters so much. Knowing your community matters, and particularly when it comes to helping people in situations of crisis, you know what it looks like to show up for them. Les intervenants et vous tous dans cette salle, et les experts, vous connaissez
You
votre...
are the experts, so you know your communities, you know the unique needs of your regions. It's vital. Knowing one's community is important, especially when it comes to helping people in crisis.
This is important because everyone's needs are different, and those differences truly matter. We know that while suicide can affect anyone, some groups have higher rates of suicide. I take a moment to acknowledge our Indigenous peoples, men and boys, older adults, members of the 2S LGBTQI+ communities, and people who live in our rural and remote communities. And I'll take special note, as I have before, to our communities in Nunavut and our young people there. We see you. We are here for you each and every day. People have diverse needs and may not benefit from the same kind of help delivered in the same way. And at the same time, they are our family, they're our friends, our neighbors, and our colleagues, and we care for them deeply. There are also many other factors that can affect a person's mental health needs, from unemployment to poverty and to social exclusion. We know that there are many factors in the social determinants of health and one's well-being. These are things that we are committed on working on together. A young person, for example, may face different challenges than a senior with chronic health problems. We need to meet each of them where they are. And the good news is that 988 responders have the expertise and experience needed to provide help. There is no one better place to support Canadians at this time than the team of the 988. This work is challenging, and you have taken on a lot. But I want to thank you for all the work that you do every single day for Canadians. It truly matters. So as we start to close, so we can hear from our many partners in this project, I'd like to once again thank our partner organizations you've always been there for Canadians. You've been doing this work for many, many years. This includes our local partners such as Distress Centres of Greater Toronto and the Gerstein Crisis Centre here in the GTA. And also thank you to our national partners such as Kids Help Phone and Hope for Wellness, who will continue to provide dedicated service through 988 to youth and Indigenous communities. I know I said this earlier on, but we know this. Canadians need this right now. In my short time as the Minister of Mental Health and Addictions, I've had the opportunity to visit crisis centers and see their work up close. You inspire me each and every day with the compassion and love and the dedicated work of your teams and your volunteers who, again, show up for our communities every day. I've heard so many stories of Canadians who sought mental health support from these centers and whose lives have been changed because of it, because of all of you. When it comes to mental health, we cannot work in isolation. I often say it takes a village. When we can provide much better access and services, we know that we can do it when we work together. But we must continue to take concrete steps to provide people across Canada with the best possible mental health and crisis intervention supports and resources. This is how we are going to save lives. In leaning into my Jewish tradition just a little bit at this moment, we have a beautiful saying that says, "And whoever saves a life, it is considered as if he has saved an entire world." Each phone call in the 988 is not just answering the call of the person in crisis, but the world of families and communities around them, who we are also supporting in that moment of need. On a last note, I want to take one key message away from today, and my message to Canadians is simple. If you are struggling with thoughts of suicide, please know you are not alone. Help is available. Call or text 988 during any time of day or night to talk to someone who can help you. Thank you, everyone, for being here today. The lines are now open.
Starting to get a bit emotional, I think, Minister Sachs. And thank you for your amazing words. It is my incredible pleasure to introduce probably the person who requires no introduction in this room, Dr. Alison Crawford, who is a CAMH psychiatrist and Chief Medical Officer of 988 Suicide Crisis Helpline, and to whom this country owes a debt of gratitude for dreaming up and thinking up how this could happen and support Canadians. And this is your day, it's your moment, and nobody deserves it more. Congratulations, Alison, welcome to the podium.
Thank you so much, Sarah. It is amazing to speak to this room. There's so many familiar faces, and I really feel like I'm speaking on behalf of such amazing people, both at CAMH, but also all of our partners. We had people on the Zoom today. It's a tremendous moment. It's very exciting. And then we remember our Senior Vice President of Clinical, Lee Fairclough, reminded me this morning, because I was getting a bit worried. And she said, just remember the people on the other end of the line. And it's so true. Those calls were coming in last night. And so the excitement is real. And it's because we know the important work, the necessary work that people are doing. And it's so wonderful to be a part of it. So thank you. I also want to thank Minister Sachs for being here to make this important announcement. Also, Parliamentary Secretary Briere, it's amazing to see you again and have you here. And to the many incredible partners for joining us today. Some are here in person, some are online. And most of all, for me, a special thank you to my CAMH colleagues. I'm really here speaking on behalf of everybody. For all of the incredible work, being here at 3 a.m., making sure those calls went through. Suicide can be a tragic outcome when people feel disconnected or isolated. We know that. It affects people of all ages and backgrounds. 4,500 lives are lost to suicide each year in Canada, and that's 12 people every day. For every person who is lost to suicide, many more experience thoughts of suicide, have suicide attempts, often alone. And behind those numbers are all of the people impacted, the families who've been shattered, the communities who are also impacted. This is doesn't just affect individuals, it affects all of us. It is our collective responsibility to address this crisis. Walter Lindstone, when you opened today, it really also helped ground me. And what you offered to Gitchimana do, what are we being called to do? And I think this is just a small piece of what we're all called to do and how we can be a community. Even with technology, we can really be a community to be there for others. And we know that that can make a difference. During my nearly 20 years as a psychiatrist, I've said this a few times throughout these announcements, but it is so genuine and so true that being connected to somebody can be transformative for both people, just by being authentically present, by listening without judgment, by recognizing that person's strengths and their worth. I have the privilege of accompanying people through their struggles, and through towards hope. Wherever people feel alone, we need to establish connection. And we know that suicide prevention helplines can do just that. They help establish supportive connections that save lives. That's why today, the launch of Canada's 988 Suicide Crisis Helpline holds so much hope and so much promise. That is real. We are live, so I'm going to say it again. 988 is live. Woohoo! It's taking a while for that to actually sink in. 988 was created to make it as simple as possible for people to get the help they need, no matter who they are, no matter where they are in Canada. Starting today, people in Canada who are thinking of suicide or worried about someone they know can call 988 or text 988, where they will get a trained live responder 24 hours a day, 7 days a week, every day of the year in English and in French. Over the past year, as I've mentioned, the team at CAMH, all our partners across the country have worked hard to bring 988 to everyone in Canada. When someone calls or texts 988, I'm going to tell you a little bit about how it works and what they'll experience. First, they'll hear or see a brief pre-recorded message to let them know they're in the right place. They'll then have a few options, whether they'd like to talk to someone in English or French, whether they're under 18, and whether they identify as First Nations, Inuit, or Métis. We're lucky to have Kids Help Phone and Hope for Wellness as part of the 988 network to offer this specialized support. The message will also let people know how they can find out more about using the service. Everyone who calls or texts will be connected to a responder who will listen, who will provide support with empathy. The people who answer 988 calls, they deserve a special moment here. They are people across our country, in our communities, people just like you and me, of all ages and backgrounds, and they are all driven by the desire to make that connection and to help. All 988 responders will receive training in suicide prevention, and that includes how to engage with people, how to assess for suicide risk, but also strengths. And then they work collaboratively with that person to help them keep themselves safe. 988 has a growing network of 39 experienced local, provincial and territorial, and national crisis service providers across the country. And it's their responders who will answer calls and text to 988 and provide these life-saving supports. Support close to home is one of the most important 988 principles, and these partners are critical to the service locally. Because of them, people who reach out to 988 will be able to connect to a responder who understands them and the context that they're calling from. 988, though, it's not just about averting crisis. It's really about building bridges to hope, resilience, and a path to safety. 988 has a focus on suicide prevention. Our primary goal is to prevent suicide, but no one who reaches out to 988 will be turned away. Everyone who calls or texts will get support, whatever they're going through. So today my message is this: you are not alone. That's the most important person to speak to, is the person who might call or might text. 988 can offer you a non-judgmental space to talk. Whatever you're going through, please know you can always reach out to us. Minister Sachs and the entire federal government, thank you for supporting this life-saving service. I'm looking forward to the continued work. We know there will be work involved, and we are dedicated and committed to it. I know we all want to work together for people across Canada and really contribute to a world in which life is worth living. Thank you so much. Thank you. And now I want to introduce a very special person, Andréane Deschamps, who is the Vice President, Clinical Operations and Chief Clinical Officer for Kids Help Phone.
Thank you, Dr. Crawford. It is a privilege and an honor to be here today. My name is Andréane Deschamps, and I'm the Vice President of Clinical Operations at Kids Help Phone. Kids Help Phone is a national service. We support young people from coast to coast to coast, and I've come here today from Quebec. Today is truly a historic moment for Canada and for all of us, and it is truly emotional. It is for me. I think of my loved ones. I think of the people that we've lost, and you may be thinking of them too in this room today and across Canada. I'm honored to be standing here today on behalf of Kids Help Phone, a national service partner to 988. We are doing this alongside the Government of Canada, CAMH, and 39 other organizations across the country. At Kids Help Phone, we have been supporting young people at risk of suicide for 34 years and counting. We connect with kids as young as 5, up to 29, and sometimes more. And we take their call and their text in the moment when they're struggling and they feel like there is no hope. And we nurture their strengths and we nurture their resilience, and we are there to provide them hope. We are there for them. I've had the privilege of working at Kids Health Phone for 15 years, and I started my journey at Kids Health Phone as a counselor on the front lines myself. That is where my heart is, supporting people. I say that with a lot of pride every time I talk about my journey at Kids Health Phone, because I've had the privilege of witnessing what it is and how life-changing a single conversation can have in the life of a young person when you pick up that call. Being there in the moment makes the difference. Je travaille à Jeunesse J'écoute depuis maintenant 15 ans.
I've been working at Kids Helpline for 15 years. I started as a frontline counsellor. It's a great pleasure for me to work with young people and to see how important it is to provide them with support when they really need it. It really can change a life.
And from that perspective of the front lines, I'd like to share a few things that we've learned from young people. About 22% of all the courageous young people who call Kids Health Phone talk to us about suicide. It is very real, and they are experiencing this. And when they do, they are met with incredible compassion, they are met with care, they are met with excellent service and skills. We are there to support them in building a safety plan, and sometimes that safety plan is getting through the night and then figuring out what is next. Something else that we've learned from young people as well is that one of the #1 barriers for them to be accessing support is because they actually think their problems aren't big enough to seek help. And sometimes they even think their problems are too big, that it's just hopeless. What's the point? And we hear that today, right now, from young people. 49% of young people who call us tell us if they hadn't called or texted, they wouldn't have sought support anywhere else. And we are proud to be there in that moment. And this is why 988 is so important. When someone calls or texts, being there to pick up that call and that text can be life-saving. A few weeks ago, one of our volunteer crisis responders received this message that I would like to read to you today. You have helped me so much. When I texted first, I was thinking about ending my life. I had no one to talk to. I was alone and I was really, really difficult situation. It is not all resolved, but I feel calmer. I can breathe a little. You saved me. That is the power of a single conversation with someone in need of support. And it's what we do every day. Kids Health Phone is ready for this historic moment and to be part of 988. This service will support people in need and it will save lives.
We're ready for the historic moment. We've worked very, very hard to prepare for it. We're very proud to be part of the 988. We know that this service will save lives and will make a difference in people's lives.
3, 4, 10 years from now, when we look back at what we are doing right now, is that we will be proud of our country and we will be proud of our organizations who have been part of creating a network of changing lives and saving lives. Merci. Now I'd like, And now it is my pleasure to introduce Al Raimondo, a 988 Community Member Advisor, to the stage. Al, please come on.
Good morning, everybody. My name is Al Raimondo, and I'm a Community Member Advisor for 988. It's an absolute honor and joy to be here today representing the Community Member Advisors who helped co-design the 988 service, from the technology to the clinical model that folks are using to the communications and how it appears. It's super exciting for me that we're here and that it's launched. I come to this work as a person with lived experience, as somebody who has attempted suicide and experiences feeling suicidal more often than I would like. To talk about why this is so important, I want to take you back to a couple times in my life where I felt suicidal. The first time I remember feeling suicidal, I was 13. And to take you into the brain of somebody experiencing this, Staying alive was so much work. Everything in my brain was telling me that it wasn't worth it, that it was not worth it to reach out, that no one would be able to help and they wouldn't understand. There was so much energy just trying to wake up every morning, just trying to find some reason to keep going, that trying to find a crisis number that helped me felt impossible. At that time, at 13, I didn't have the right words to put into something like Google and find the service that was meant to be there for me. So I chose to do nothing, and unfortunately ended up attempting suicide and ending up in the hospital. Many years later, after working in mental health for 10 years, I found myself suicidal again. I had just been diagnosed with breast cancer at 31 and was absolutely terrified about what my future would hold for me. At that time, you would think that somebody who's worked in mental health, who's been through this before, would understand what was happening and would reach out. But the overwhelming fear, the idea that no one was going to be able to help me, the bad voice in my brain telling me that it wasn't worth it and that I wasn't worth it were so loud that even though I knew what to Google this time, I didn't know which of those services would have worked for me. They all fit and they all didn't. That brings me to another reason why I'm so excited this is happening. As a mental health advocate for the past 10 years, there have been years in my life where I've gone to more funerals and birthday parties. I know how tenuous these situations are, that you can save a life, but somebody can so much fall through the cracks and not be saved. So it brings me incredible joy that we have a phone number and text number that's easy to remember. I know when I'm struggling, remembering a 10-digit phone number is so difficult. So having something as easy as 988 to remember, to call and text, no matter where I am in this country, no matter what time of day it is going to be so helpful for me as somebody who sometimes experiences thoughts of suicide, and also gives me so much joy to have that in my back pocket and in my phone, so that when my friends or community members are experiencing thoughts of suicide, that I have somewhere to send them. To speak to other folks like me who have lived experience, I know your brain tells you that it's not worth it. I know your brain tells you that it's not worth reaching out, and I want to say it absolutely is. No one is asking you to solve all your problems right now, but they're asking you to hold on a little longer, to find hope, to wake up tomorrow and try again. I know so many of you will also think that people won't understand and they won't get it, and the problems are either too big or too small, as a previous speaker mentioned. And I want to say that they do get it. They're there to walk alongside you. They're there to be there for you, to listen to you, and to tell you that you're worth it. You're worth trying again. To end today, I just want to say I'm so excited to not only create this for myself and for me to use, but for all my community members and friends. And one of the guiding principles in my life is building and being who I needed when I was younger. And I think 988 is going to be that for me, for next generations of folks, and for so many other people with lived experience. I'm so excited that the lines are open, and if you think this could help you, please, please give it a chance and reach out. Thank you.
Wow, what a moment, what a day. Thank you, Al. Thank you to our incredible 988 partners. Thank you to the federal government. Thank you to the Public Health Agency of Canada. Thank you to the amazing CAMH team, and thank you to all Canadians who will put their trust in this service. I would now like to pass it over to the moderator for any media questions. Oh, over there. Okay, so I think we probably.
Okay, thank you, merci. We will now proceed to questions from journalists in the room. Please state your name, media outlet, and who your question is directed to. You will have the opportunity to ask one question with one follow-up. In addition to our speakers in the room, we also have Dr. Tom Wong from Indigenous Services Canada joining us on the Zoom in case there are questions for him to address. Nous allons maintenant passer aux questions des journalistes présents dans la salle. Veuillez indiquez votre nom, votre média, le destinataire de votre question. Vous aurez la possibilité de poser une question avec un suivi. En plus des intervenants dans la salle, nous avons également le Dr. Tom Wong de Service aux Autochtones Canada qui nous rejoint sur Zoom au cas où il y aura des questions pour lui. Let's proceed to the first question. Nous allons passer à la première question.
Hi, Mirna Djukic for Radio-Canada. Thanks for taking my question. Je vais adresser ma question à la...
I'd like to ask my question of the minister or of Member Brière. There are also several helplines across the country. I'd like to know if you have identified gaps in some areas and what is the need that's being filled by this new 988 line. Could you tell us that, please? Thank you for the question. Well, 988 works in the following way. We've established partnerships with existing lines, existing services. We're not there. We're not here to replace what already exists, especially in Quebec, with the 988 J'appelle line. Now, in northern communities or for French language services, well, there was a need to improve things. So this is why we have worked in partnership with various partners to actually extend the service and to fill the gaps that exist. Could you give us details about the resources, the budget that's been allocated to this initiative, and how much time did it take to actually develop the line? Well, we've been working on this initiative for some time now, and intense work over the past 2 years. Now, if you compare with what the US did, it took them 4 years to actually establish their suicide crisis helpline. So we're very, very pleased to be able to open the 988 line in a very short time period. And the amount, the budget, we've invested $158 million at the outset, and we've added 66 million in additional funding along the road.
Thanks so much. You answered part of the question in French that I'm about to ask you. So I was wondering if you could talk a little bit about how many responders you have trained, ready to go. And previously it was stated that you're hoping to get more. Is there a time frame for that?
Thank you for your question. So you heard me say how important responders are, and the fact that they are trained, and the fact that they are doing this work. Some are paid, some are volunteer. And we've been working hard at CAMH with all of the partners, the 39 partners, over the last year to make sure that we have enough responders to answer calls. That's going to be an ongoing process. We are constantly, we're looking for people interested in this work. We have over 1,000 people already trained, and I know that we'll get many more because I think as people find out about this, in fact, it's happened already. People want to be part of it, but they will volunteer for one of the partners.
Thank you. And just to follow up, the assumption is, you have this resource available. Perhaps you're going to be seeing more people, and maybe you could talk to this, reaching out for help. If that's the case, are service providers equipped to handle perhaps with an increased demand for people who need supports?
Yeah, we also know that if you're calling 988, you need help right away. So we're we pay attention to response time. That's incredibly important, and the responders are who helps us with that. So the call will first go closest to home. We also have additional capacity built in, and we have technology that helps us to do that and balance things out across the system. And we're going to be watching those numbers every day and responding to any increased demand for calls or texts.
Good day, Kirk Brown, Rich Global News, hoping to hear from both CAMH and the Minister Sachs on this. There's not a lot of scientific research available on the long-term effectiveness of suicide hotlines and even less about the effectiveness of texting services. Is that a concern for you with this project, and how will success be measured for you?
It's a great question. First, I'm going to turn to the positive story. There's research, and quite robust research, that shows two things. One, people who are in serious distress call and text crisis lines. So we know that this is a service that reaches the people who need it most. We also have research that shows that distress tends to decrease during that time. And we know from suicide prevention work, from clinical work, that decreased distress, that feeling that one can cope, those are the essential tools when one is in a suicide-related crisis. So I think that is actually a lot of evidence. And in addition, we're really keen to look at evidence down the road. How does this affect people's lives, months and years later? But we know that it works in the moment.
Minister?
I don't think I have much to add from Dr. Crawford on this, but what I will say is the purpose of the 988 is singularly clear in its focus. It is in that moment of crisis for prevention. There's no question that there is a need for robust supports for what we call the warm carry for someone for once they are through that time. And this is why the federal government is so committed to the work that we are doing, not just in the 988, but in mental health supports and services, working with provinces and territories to ensure there's a robust system in place.
And a quick follow-up for the minister, if I may. Are you satisfied with the 3-year timeline it took to get the hotline up and running?
It was actually closer to a 2-year timeline, and I would say absolutely yes. Throughout this process, we've been working closely with our 988 counterparts in the United States for best practices, lessons learned. It took 4 years to build their system. So with leaning in with an incredible team at CAMH and the department and PHAC, who I'd like to acknowledge as well, we were able to move swiftly to make sure that we had a network that was fully operational so that no calls would be dropped in a 2-year timeline.
Okay, thank you, merci. We will pass to the Zoom now for any further questions. Nous allons passer à Zoom maintenant pour toute autre question.
Thank you very much. If you're a reporter and wish to ask a question on Zoom, please use the hand raising function. We ask that you limit yourself to one question and one follow-up. Unless I have stated it, please indicate your name and media outlet before posing your question. Si vous êtes journaliste et vous désirez poser une question, veuillez utiliser l'option de lever la main. Merci de vous limiter à une question et un suivi. Sauf si je l'ai dit, veuillez identifier votre nom et votre média avant de poser votre question. Hi there, I see there's a question from David. David, can you please identify your media outlet? Doesn't seem like we can hear David, so we will move on. Are there any other questions on Zoom? It does not appear like we have any. Oh, David, go ahead. I think we lost him again. It does not appear like we have any other questions on Zoom, so this concludes our event. Thank you very much.
Recording stopped.
Oh my goodness. Thank you.